The high-speed handpiece runs at speeds from 250,000 to 400,000 revolutions per minute, or RPM. This extremely fast speed of instrumentation allows dentistry to be performed much faster and more efficiently. The high-speed handpiece is used predominantly for decay removal and cavity preparation. The slow-speed handpiece operates at a much slower speed and is used to hold many different types of attachments that are used to accomplish different dental procedures. The group of instruments used for a particular procedure, like an amalgam restoration, are usually cleaned and packed together in a sterilization bag or procedure tray setup. The sterilization bag is stamped to identify the contents of the bag. The sterilization bag, or the tray setup, is then placed into the sterilizer, sometimes referred to as an autoclave, where the instruments are sterilized. Some dental offices use procedure setup cassettes to organize the instruments and accessories used for dental procedures. The instruments are positioned into cassettes according to the sequence in which they are used. The position of the rubber rings helps you locate the instrument's position on the cassette when setting up the cassette. This system enables the entire setup to be kept together during cleaning, sterilization, and storage. Setups can be organized for any procedure in dentistry. Notice how the matrix band looks like a wide V. The top or open end of the V is always placed at the gingival of the tooth, and the bottom or closed end of the V is always pointing at the occlusal of the tooth. All teeth widen from the gingival area to the occlusal surface. When the matrix band is folded, the bottom or closed end of the V on the band is always placed into the slot of the Tafelmeier retainer first. Let's review the instruments commonly used to perform endodontics or root canal therapy. Special endodontic instruments are used to instrument or clean and shape the pulp canals in teeth. Three common types of endodontic instruments are reamers, K-files, and Hedstrom files. Shown here are the different types of cutting edges on each of the instruments. The reamer has the fewest cutting edges and does not cut aggressively. The K-file has more cutting edges and is sharper, which enables it to cut quicker than the reamer. The Hedstrom file has extremely sharp cutting edges and cuts very quickly. A small hole called an access opening is drilled into the tooth to reach the pulp chamber. An endodontic explorer is used to locate the canal orifices or openings into the pulp chamber. This is tooth number 8, an incisor, and it only has one canal. This makes it easy because we only have to locate one opening.